What is emphysema, and how does it relate to COPD? Have you ever wondered how certain lung diseases affect your breathing? Today, we are going to talk about emphysema and its connection to chronic obstructive pulmonary disease, commonly known as COPD. Emphysema is a specific type of COPD, which is a group of lung diseases that cause airflow limitation and breathing difficulties. COPD includes both emphysema and chronic bronchitis. Many individuals with COPD experience symptoms from both conditions. Emphysema primarily impacts the air sacs in the lungs, known as alveoli. Normally, these alveoli are small and elastic. They inflate when you breathe in and deflate when you breathe out. This process allows oxygen to enter the bloodstream and carbon dioxide to be released. In emphysema, the walls between many of these air sacs become damaged and destroyed. This leads to fewer and larger air sacs instead of many tiny ones. The damage reduces the lung's elasticity and surface area for gas exchange. As a result, it becomes harder to breathe and get enough oxygen into the blood. The main cause of emphysema is long-term exposure to lung irritants, especially cigarette smoke. In fact, cigarette smoke accounts for up to 90% of emphysema cases. Other causes include exposure to air pollution, chemical fumes, and dust. In rare cases, a genetic condition called alpha-1 antitrypsin deficiency can also lead to emphysema. The damage caused by these irritants usually gets worse over time. COPD is characterized by persistent respiratory symptoms and airflow limitation due to abnormalities in the airways and alveoli. Emphysema represents the alveolar damage part of COPD, while chronic bronchitis involves inflammation and mucus buildup in the airways. Although emphysema and chronic bronchitis are distinct, they often coexist in individuals with COPD. Understanding emphysema within the context of COPD is essential for diagnosis and treatment. While there is no cure for emphysema or COPD, there are treatments available. These include medications, pulmonary rehabilitation, oxygen therapy, and in some cases, surgery. Avoiding smoking and other lung irritants is critical to slowing the progression of the disease. Emphysema is a form of COPD that damages the air sacs in the lungs, leading to breathing difficulties. COPD is the broader disease category that includes emphysema and chronic bronchitis, both of which contribute to airflow obstruction and respiratory symptoms. By learning about emphysema and its relationship to COPD, you can better understand the challenges faced by those living with these conditions.